Welcome to In Session, the North Carolina Healthcare Association's podcast where we dive deep into critical issues impacting hospitals, patients, and the overall health of our communities. Whether you're a legislator, policy advisor, or community leader, this series is designed to keep you informed about the challenges and opportunities in healthcare today. Here's your host, Doug Herron, Senior Vice President of Advocacy, Policy, and Communications.
Thanks for listening into the very first episode of In Session. We're so excited to launch this project and foster important conversations about some of these challenges. Before we dive in, we want to set the scene just a bit. The North Carolina Healthcare Association, also known as NCHA, is now under new leadership. Our new CEO, Josh Dobson, came on board late last year. Josh most recently served as the North Carolina Commissioner of Labor, following 8 years serving in the State House of Representatives, where he represented the 85th District, covering Avery, McDowell, and Mitchell counties. Josh, we're thrilled to have you on board. Thank you for joining me today.
Thanks so much, Doug. Good to be with you guys.
The association is known for its work to advocate for hospitals and improving the health of communities across the state to benefit all North Carolinians. Josh, tell me, what's your vision for the association under your leadership?
Yeah, thanks, Doug, for the great question. And I do appreciate you having me on. I think the first thing I would think about is there's no need to reinvent the wheel. The vision of NCHA before I got here was a North Carolina where high quality health care is equitable and accessible for all. And I think that's where we need to start. We can do that by following our strategic plan, which includes finding unity among our members, effective advocacy on issues that are important to our members, and embedding advocacy in all parts of our organization. So that's where I would start, and that's kind of the foundation of what my vision would be. But beyond that, three things that I've been preaching internally to our team that I think are important for our future together. The first one is members first. Everything we do at NCHA is to benefit and add value to our members. They pay dues to our organization because they really do believe in us and they believe in our organization. So I think, Doug, we do have a responsibility to live up to that confidence that they have in us. So we need to have a mindset at NCHA that everything we do should add value to our members. If it doesn't, we shouldn't be doing it. The second thing is what I like to call hyper communication or over communication among our NCHA team. I do believe, Doug, that there's not a problem that we can't work towards solving and that we can't all solve together if we're all on the same page. But if we're not communicating with each other, it's virtually impossible to solve these important problems and these important challenges that are important to our members. And then the third thing, as part of my vision to accomplish NCHA's vision, is constantly earning trust. If you'll indulge me in a moment of full transparency, after I left the General Assembly, I was chair of House Health Policy, HHS appropriations, full appropriations, and I'd moved over to the Department of Labor. Subconsciously, I'll be honest with you, I didn't think I needed to earn anybody's trust. I was the Commissioner of Labor coming in, and I'd already earned trust at the General Assembly. I don't think I fully appreciated that when you start at a new organization, everybody starts from zero, and you have to start earning trust all over again. And I had to realize that as the CEO, that does not make me immune from earning the trust of our team. So I'm constantly trying to get up every day thinking about how I can earn the trust of our employees at NCHA. And I preach to them while they try to earn my trust at the same time to earn each other's trust. That's part of my vision, to make sure as we go forward together that we deliberately and consciously get up every day and think about how we can do that and how we can build trust and earn trust among each other. And if we do those things, I think the sky's the limit.
Thanks for that, Josh. That's great. And that's just a reminder why we at NCHA and our membership is so excited about your future as our CEO and leading us into this next exciting chapter in the history of the NCHA. And with that in mind, you and I have talked quite a bit about the association becoming a solutions-based advocacy organization that partners with our lawmakers at the General Assembly to drive healthcare forward in the state. So under your leadership, what does that vision look like to you?
Sure. Thanks for the question, Doug. While we have to earn the trust internally, if you're going to be a solutions-based organization that others look to to solve problems, I think you have to establish trust, particularly with legislators. They have to know that we're going to be on the level and we are going to be an honest partner and an honest broker. You also have to establish trust with other stakeholders, those that you agree with and those that you may not agree with. And they have to know that we are an honest broker. It's very difficult to negotiate and work through challenges if that's not the case. So I think it's important that we deliberately and consciously think about that as we move forward to tackle some of these hard issues.
Trust and relationships, Josh, you're spot on. That's exactly what I think we need to be focused on heading into the long session for 2025. Speaking of which, this year is likely going to be a long session, as some folks have promised that we could be in for as long as 8, 9, 10 months, given the new political dynamics in North Carolina. We can't dive too deeply into our legislative agenda, given the time restraints of this podcast, but what are some of the goals that we hope to accomplish during this upcoming session from your perspective?
The Healthcare Access Stabilization Program is very important to our members. Therefore, it's very important to us. So part of our focus for this agenda is preserving the Healthcare Access Stabilization Program, or what we know as HASP. If we can preserve HASP dollars for our members, I think that's going to be critical to our success. Prior authorization, I don't need to tell you, is going to be a top subject for a top issue for a lot of different entities and individuals. So enacting prior authorization reform, addressing the challenges our members are facing regarding children in the ED. And I know that's something very important to you, and I look forward to you and your team's work to address that policy challenge as well. Our members are working hard to meet the needs of their communities, and it's important that we make sure the General Assembly knows how important it is for us to not add new tax burdens on the hospitals across our state. And then lastly, this one's important. This is not part of the legislative agenda for North Carolina, but something I'm really have a focus on is, and not to get too wonky about it, but the 90-10 FMAP split for the Medicaid population, where 90% is paid by the federal government and 10% is paid by North Carolina, primarily our members. And I think this is important for our viewers to know. If the federal government changes, if Congress changes that 90-10 formula by 1%, then Medicaid expansion goes away in North Carolina, and 600,000 people who have health care today will not have it tomorrow. So it's really important that we relay that and reiterate that to our congressional delegation, how important that is and what that means if that FMAP 90-10 split is changed across the country. So those are some of the things that I think we need to focus on and really kind of drill down on.
Yeah, I was fortunate enough to live through the 2023-24 session at the General Assembly as a lobbyist and working on some really great things like Medicaid expansion, as you mentioned. And I thought that might be the most consequential session we ever had on healthcare issues. But I think looking forward for 2025, both with respect to what might be before us in North Carolina, but also in Washington, D.C., to your point about the Medicaid changes that we might be faced with. There's a lot for us to be looking towards, both in Raleigh and in D.C., that are going to be challenging moving forward. And speaking of which, on our next episode, we'll be taking a closer look at the NCHA's legislative agenda that we hope to address during the 2025 long session and potentially carrying over to 2026, but also assessing the political landscape in light of the results of the 2024 election. So lots to talk about there on our next episode. We hope this podcast will break down some barriers and will help create a deeper understanding of our work. Josh, thank you for joining me today on our inaugural episode of In Session.
Thanks so much for having me.
Looking forward to the work we will accomplish. Thank you for listening.